Hello, this is Dr. Shane Stanley, and I'm here today to talk to you about non-surgical spinal decompression. I've been doing non-surgical spinal decompression in my office now for over 5 years, and the first thing I'd like to talk about is what type of patients are helped from this procedure. These are patients who have disc herniations, disc bulges, degenerative disc disease, spinal stenosis, facet syndrome, sciatica, pain going down the back of their leg all the way into the foot, numbness in the foot. Also people who have neck pain, disc herniations or disc bulges in their neck, carpal tunnel symptoms, pain going down their neck into their arms, tingling in the fingers. Patients like that who have those type of disorders, what they do is they'll give our office a call and we will do a consultation on them and also do an examination. At that point we'll also look over any MRI or X-ray they may have. And to illustrate what we do and what we're looking for, I thought I would grab a model here to show you how that's done. This is a simple anatomy lesson, and this is 2 vertebral bones and a disc. So in a normal spine, in a healthy spine, what we want to have are real thick disc spaces like you see right here between the bones. That is a good and healthy disc. Now what happens over time, as you'll see in this other model, is the disc can become real thin, as opposed to the nice thick disc right there. And the disc are the padding in between the bones that protect the bones from decay and also help absorb shock from the spine. Now, if we do a cross-section of the disc, which is this piece right here, the disc is composed of 2 pieces. You can see it has an outer piece and an inner piece. And what can happen over time when the disc gets thinner or gets weak, the inner piece right here can actually pop out of the outer piece. And when it does that, it can press up against these neighboring nerve roots right here that come out of the spine, right here. So what I'm going to show you is a cross-section of a desiccated or degenerative disc and show you what a disc herniation or a disc bulge looks like. And we can see that illustration right here. If you look at it, now you can see that piece is actually leaking out. And you can see it over here. Bring it into the light a little bit better. And now you can see the piece is actually leaking out. Now what it's doing, it's pressing up against this nerve. And if I do a section, see that little bulge right there? That's what a disc herniation or a disc bulge would look like. And these are the patients that we treat daily here using non-surgical spinal decompression with a DRX 9000. Now, a lot of people ask, how does the procedure work? And what the DRX 9000 does is it'll take that disc that's been compressed, because the disc is thin as we mentioned. It'll basically take that disc that's been compressed and it'll open it up and it will decompress it, taking the stress out of it. And what the machine does, it kind of works like an accordion. And what it will do is it will take the bone in and out. It's basically creating a pump. And it's that pump that actually helps to bring nutrients and fluids back into the disc to help hydrate the disc and help make the disc healthy. Now the second thing the DRX 9000 does with non-surgical spinal decompression is it creates a negative pressure within the disc. Now, a good example of a negative pressure, if I take a ketchup bottle and I squeeze the bottle, as the bottle expands, anything in the rim gets sucked back in. So basically what decompression does, it takes that disc material that's been herniated or bulged, and it will retract it back into its position, therefore taking the pressure off of the nerves. And now what we'll do again is I will actually show you a picture of the table and show you how it works and how we set people up for the different conditions that they may have.